Hi everyone. I wanted to take a moment to talk about the what, the who, the when, and the how of medical gaslighting. Medical gaslighting is really epidemic to particular populations. Now, I think that it hits everyone at some point, regardless of gender, race, sexual orientation, or any of those things. So I think that this is relevant for everyone. It does not matter how you identify. At some point, you are probably going to be medically gaslit. Is it on purpose? Is it a vindictive thing? No, not always. And so that's why it's hard to discern, and you walk away feeling confused because your provider may have the best of intentions, but be operating on outdated information or be so limited by the system that their hands are tied because they don't have enough time with you. They don't have enough of a skill set, because that's not what's valued in our current medical education, to talk about maybe lifestyle changes, for example, which are the number one driver of our health outcomes. It's not the healthcare that you get. It is what you do in your life day to day that makes the biggest difference with your health outcomes. So if our current medical system isn't set up to value talking about lifestyle changes, which we call lifestyle medicine, it can include integrative medicine, and a range of evidence-based, scientifically supported practices. That does not include alternative medicine because there's not necessarily a scientific evidence base to support it. So I am teasing out alternative medicine from the stuff that we know the science supports, which is complementary and integrative medicine and lifestyle medicine. Okay, so that being said, it does not mean that your provider is just out to get you. It could mean that they don't have enough time, their hands are tied, or they have gotten caught up in a system where now they have forgotten how to provide that compassionate care. So this is not a video to give healthcare providers a hard time. I am one of them. I am a physical therapist. I've been a combination of athletic trainer, which is a licensed profession, physical therapist, for 30 years, this upcoming next year, which will be 2025. So I have been around the block once, twice, 3 times, a bunch, as a provider in that system, and also outside the system as a patient. So who gets gaslit, right? We know what medical gaslighting is. It's when you feel like you haven't been listened to, like you went in and your concerns, your story wasn't heard. If you feel that, you probably have been medically gaslit. You should always walk away from your provider feeling heard, and that you have constructed a plan together that you feel empowered to help carry out, and that you understand and feel confident about. If you don't feel that, then that is medical gaslighting. So that's the what. What about the who? The who of medical gaslighting. Are you female? Sadly, if you're female, you've probably already experienced it. If you haven't, unfortunately, you will. That means you have to go in a little bit more prepared because you're female. I know, it's stupid. You have to be more informed. You have to be more assertive. And you have to not take no for an answer, right? You have to maybe pursue a second opinion, maybe a third opinion. I have lived this out personally many times in my life as a mother, as a person with endometriosis, and just as a female in general, of not being listened to. Do you have a weight management problem? You're more likely to be medically gaslit. Do you have pelvic pain? Huge one. And you have overlapping things like gastrointestinal issues or autoimmune issues, right? Then you're more likely to be medically gaslit. Are you a person of color? So if you're a person of color with pelvic pain, with weight management issues, I'm so sorry. Because that is the most likely scenario for you to get medically gaslit. And my deepest, most sincere hope that this does not happen to you, I send out to you in vibes right now. Are you a person in the LGBTQIA community? Are you transitioning, right? then you're more likely to be medically gaslit or frankly just turned away and your healthcare concerns not attended to. But the two biggest categories here are probably female, person of color, and let's include pelvic pain as well, because it has been ignored across genders, okay? So I'm talking about everyone in that case. So if you have pelvic pain, don't care what gender you are, or if you're female or person of color, or female person of color, here we are. That's the who gets medically gaslit. When do you get medically gaslit? I have more examples than I have time. If you have endometriosis, if you have complex pelvic pain, which is endometriosis, if you have gastrointestinal issues, most issues seen by gastroenterologists are going to be what's called functional gastrointestinal disorders, AKA there's no pathology. It's easy for them to go, oh, you're just stressed, it's in your head, because there is no pathology there. But have they dove deep enough, right? I went in and was medically gaslit for years. The first time I went to a gastroenterologist, what do they want to do? Good old colonoscopy. I said, that's not where my problem is. I can tell you that. And I am so glad that I did not allow them to do that, because I went on to then this past year finally get to the very bottom, literally, of the problem. And had they gone in, I could have easily had a bowel puncture because of the abnormal way that the bowel had grown and was located in my abdominal cavity. That would have been incredibly high risk and could have resulted in me having massive surgery or being septic or actually having to wear a bag, right, for a colostomy. So I'm so glad that I listened to my gut, because at that time it was a different issue. And I told him that specifically, for example, in this gaslighting issue, that it was the gallbladder, and they wouldn't listen at all. Guess what it was? It was the gallbladder, right? As a healthcare provider, I went in with the knowledge of knowing what it was, told them what it was. They still wouldn't listen. I declined the care that they would not have gotten any information from anyway. And then I went on to have to find a second and a third person finally to listen and say, oh, wow, when we scanned your gallbladder, you have no functioning left in your gallbladder. It must be taken out. If I had had the right care, then things would have not gone sideways so many times. So yeah, I have lived through medical gaslighting again and again, but these stories that I'm sharing with you, these are stories of patients also. Patients with abdominal adhesions that are ignored. Oh, it's all in your head. Don't pay attention to that. And then when they get the attention that they need, that's exactly what it was. The adhesions were in those places and they had to be cleaned up. So don't ignore abdominal pain and visceral pain. So here, right? Don't ignore pelvic pain. Find someone that will listen to you and help differentially diagnose. That could be your pelvic PT, because they are well-versed in, should be well-versed in listening to your story, differentially diagnosing all of those points, and then making the proper referral. It's not necessarily in your best interest, if you have pelvic pain, for example, to go to your PCP. They are not trained to evaluate that. In their defense, don't burden them with that, that heavy of an issue if they don't have any skills in evaluating that. You are better off going to your pelvic PT first, so they can tease through all of the pieces and go, I think you're better off with a GI, or maybe Urogyne, or maybe your gynecologist, right? Or maybe the urologist. They're going to do all of that for you, okay? So again, specific diagnoses in terms of when it happens a lot with pelvic pain. It happens a lot with things like endometriosis, pelvic organ prolapse, painful intercourse, because no one wants to talk about it. And then if you talk about it with a provider who doesn't have training in it, they'll be like, I don't know, have a glass of wine. Here's some pain medication. I don't know what to tell you. Or you should just go see your gynecologist for that. So again, that's another reason for you to then go to see a pelvic PT or OT. But I would say if you are having an overlapping orthopedic issue, like a hip pain, gluteal pain, back pain, that kind of thing, you might be best suited to see a pelvic ortho PT, someone that has been steeped in orthopedics, not just pelvic health. So there are times and places for seeing, either of those. So I could give you other examples. Oh, I forgot to mention interstitial cystitis or painful bladder syndrome. That's another one that you could easily get medically gaslit over. Men and women, I have seen them gaslit over that. I have seen men in their 20s come in diagnosed with chronic prostatitis who were told to just catheterize themselves to urinate when it turned out to be a pelvic floor dysfunction that we just needed to simply treat. It's not simple in treating it, but once we simply treat that and address it and stop pushing it under the rug and handing, a man a catheter to catheterize multiple times a day, check out the pelvic floor, for crying out loud, right? So again, go see your pelvic PT or OT for that. How do you get gaslit? Well, there are a lot of different ways, but I will just give you the two biggest ones. One is social conditioning. It's a badge of courage or badge of honor to just push off, oh, I don't need care. I'm good. I keep going. I've been guilty of doing that myself. Because if you're proactive as a woman and you go in and go, hey, this is a problem, they look at you like, well, it's barely a problem. Like, why are you here? I've got people dragging themselves in the waiting room. And so then you feel what? Foolish, like you have a low pain tolerance or something. And so what happens with the social conditioning of push through, no pain, no gain, is that people, and specifically women, if you look at the stats and the research on what happens with women, they're more likely to have complications from a heart disease because their symptoms are ignored. They are turned away at the ED and said there's nothing wrong with you, and then they go home and have a massive heart attack, or they've had one and it's ignored. They wait longer for cancer treatment, even after they get diagnosed, which they also have to wait longer to get diagnosed for cancer. So there's this social conditioning that women have some kind of low tolerance for pain, or we just complain for no reason, which is the opposite. We actually have valid issues that are ignored for longer. Men, for example, get taken into the ED for pain when they have the same condition of pain as a woman. The man gets taken back and given pain meds first, earlier. I'm speechless, right? So women are actually suffering longer while men are getting treated faster. So there's that social conditioning that happens, that you just suck it up and that women have some kind of low pain tolerance. Not true. And then there's the cultural, the sexism that goes along with it, that again, somehow women are weaker or hysterical, right? When we actually have, it's shown to be the opposite. Women have a pretty high pain tolerance and don't ignore things and want to go in and have them taken care of. So we get ignored as a result. We get marginalized. Our symptoms are minimized. Our stories are not listened to. For example, I had a family member who went in with their husband with, I believe this was a knee issue, but this person had been in for multiple issues. She was at the orthopedist with a knee issue, and she had asked about a perfectly safe, holistic treatment that has evidence-based to support it. And he looked not at her, but her husband, and rolled his eyes. Not okay. And then I've had a patient who went in with her husband before, just so she'd be taken seriously and listened to. Her husband was an attorney. Of course, he wasn't going to put up with the crap that she'd have to put up with, and she got better care. I had another patient who went in, and when the physician went to talk about the diagnosis of the female in the room, of the wife, he actually turned to whom? Not her to explain it, but to the husband to explain it, as if she wasn't in the room. Enraging. So there is cultural sexism, there is social conditioning, there is systemic racism in the healthcare system that we all have to be aware of, that we have these biases. I'm sitting here as a white female talking to myself that we have to be careful we don't carry these epigenetic things into our practice where we are ignoring someone or not taking someone seriously. And so you have to have that extra dose of compassion, of empathy, of provider compassion to be able to listen, take in that information, and believe you as the patient. If you don't feel that vibe and energy off the person that you're seeing, red flag. And if you have the choice, find someone different. Fire them. You can fire them verbally and say, I'm sorry, this isn't going to work out for me, or I'm not accepting that treatment. I've done that before. But then you pick your battles, and sometimes you have to silently step away and go, yeah, I'm just not going back, right? Do what's good for your mental health. There is no best way to do this. I have had people come back when I do videos like this and go, oh, you should always speak up, right? Like I should always pick a fight, like choose that battle. It's not possible. You will drain yourself completely. I've had other people go, like when I was advocating for my son and we were getting medically gaslit there. I've had people harass me about that. Oh, you should have kept him in that school system. You need to fight. I'm like, and meanwhile, my kid is getting neglected. He's not getting the care that he needs. So I'm just supposed to use my kid as a guinea pig because I want to advocate, right? There comes a time when, yes, you will pick that fight and you will advocate. And that battle is important enough to pick up the torch because everybody that comes behind you will have an easier time. There are times that I do that. And then there are times that I go, no, my kid needs care now. He can't spend 3 lost years in school not getting the care he needs just because his mommy wants to battle with the powers that be to try and improve the situation because he's losing ground every day. So you do what's right for you. You do what's right for your family members, for your kids. I forgot to talk about kids, but kids can be easily overlooked too with pelvic floor issues, with pelvic pain issues, and otherwise. In my situation, I was talking about a developmental thing with my kid, and still we were getting gaslit. By the school system, we were getting gaslit. By the providers, we were getting gaslit. We finally found someone to help. So I just want to encourage you to stay the course. If you need some solidarity, reach out. Leave me a message in the comments. My heart goes out to you if you have experienced medical gaslighting. I am so sorry. It is not okay. As a person who has experienced it and as a person who provides care in a system that is very broken, but I stay in that because I can make a difference. So that's a battle I chose to remain in. So as that person and that provider, I feel for your experience. If you are wondering where the best care may be, I can only give you so much advice. But in terms of pelvic pain, in terms of orthopedics, in terms of voice to pelvic floor connection issues, if someone's told you that your jaw pain or your voice issues aren't connected downstream, they're wrong. They're accidentally medically gaslighting you or unknowingly perhaps. Please reach out in the comments. I'm only one person, but I do a limited number of free consults to try and triage and help people point people in the right direction. I do have a clinic in Greensboro, North Carolina. I do telehealth as well, and I do teach professional courses and also open to the public courses as well. If you like this video, don't forget to subscribe and share it with your friends because together we can end medical gaslighting and help you get the care that you have a human right to and deserve.